It's a sensitive time in a woman's life. It should be the happiest time in your life, but there's also complications.
As the COVID-19 pandemic continues, guidelines for how health providers address pregnancy are changing. Council members and co-chairs for the Women's Caucus NYC Council, Farrah Lewis and Vanessa L. Gibson, explain how the single support person mandate is affecting pregnant women in New York.
I know that the policy has changed over time since COVID started. I know that they allow one asymptomatic partner to be there with someone, but I think a whole lot more needs to be changed.
With a lot of the restrictions and guidelines that have been put in place by government and hospitals, obviously for everyone's protection and safety, but at the same time, it does cause us to really rethink how a lot of these policies are really hindering a lot of access to health care.
Founder of Ancient Song Doula Services, Chanel Porche Albert, has been helping parents for over 10 years. She shares that the single support person policy has increased fear and anxiety amongst those that are expecting.
Some individuals have felt a sense of isolation, a sense of uncertainty. A lot of them are having to choose and make a decision between their partner and their doula.
The fears become increasingly alarming for many Black parents who prior to the outbreak were already experiencing high maternal mortality rates.
In the United States, African American women and pregnant people are 3 to 4 times more likely to die of a childbirth-related complication.
As COVID-19 continues to overwhelm hospitals around the city, parents of color experience heightened anxiety around the birthing process. Porche Albert tells us her organization that primarily services women of color has seen an increased interest in home birth services.
There's been an increase of people asking for them, but we don't have the bandwidth to be able to support that. So the U.S. infrastructure in and of itself doesn't have the bandwidth to be able to sustain it, let alone within New York.
In an effort to protect and provide birthing advocacy for women of color, the Women's Caucus proposes increased access to doulism, which could help address birthing disparities amongst marginalized communities.
A lot of insurance companies are not covering doulas and, midwives, and that's been another issue that the Women's Caucus has been talking about, because I think for a lot of us, it's access, it's opportunity, it's education, and we also have to empower our women.
Hospitals across New York City are currently instructed to allow one asymptomatic supportive partner, but New York State Governor Andrew Cuomo is accepting the COVID-19 Maternity Task Force initial recommendations in an effort to further support maternal health. To see the full list of recommendations, visit governor.ny.gov. Reporting for BronxNet, Kibin Aline.